Parasitic and Other Infestations, Chapter 40, page number 514 in your Child Health Nutrition textbook, page number 514, Chapter 40. So helminthiasis is the name that we give to parasitic infections. Okay, it's usually intestinal infections, and but it can lead to other systemic invasion of this parasite as well. Okay, it can escape and get stuck in other tissues, other organs, and they can lay eggs there. Okay, that is helminthiasis or parasitic infections. So helminthiasis is also known as worm infection. Okay, any macroparasitic disease. Okay, not single cellular organism. Macro and parasitic disease of humans and other animals. Okay, in which a part of a body is infected by parasitic worms, and these worms are called as helminths. Okay, there are numerous species of these parasites. Helminths, you can classify them into nematodes and cestodes. So we'll see that. So nematodes, that are the first classification. What are nematodes? They are roundworms, okay? They are round in shape. You can see they have a cylindrical shape, okay? Cestodes, they have a flat shape, like a tape, like a ribbon, okay? Nematodes are not ribbon shape. They are like a worm, okay? They are in worm shape and they have cylindrical body, okay? And they are a diverse group of organisms belonging to phylum Nematoda. That's a species. Okay, they are small and cylindrical in shape with elongated bodies. Okay, and some of them will have appendages. Okay, they will have small fingers and like to walk around. Okay, to move around in form of hooks or stylets. Okay, so they are found in variety of environments from soil to fresh water to ocean. Okay, there are various environments where you can find nematodes. Some can exist in plants as well, plants, animals, and even humans. And others are free living. Okay, nematodes play an important role in the ecosystem. Okay, and because they help in decomposition. Okay, whatever organic matter you have buried, okay, they help in the decomposition of that. Okay, and other organisms also prey on these organisms for their nutrition. That is nematodes. Okay, they have cylindrical shape, round shape, cylindrical shape, long bodies, and sometimes they will have, not all, but sometimes they will have appendages to latch onto something, hook, and even to move around. Okay, so that is nematodes. So the first type is ascariasis, that is the infection, roundworm infection. Okay, they are most common of all helminths. The egg is laid by mature female worm. You can see the female and worm, a male worm. Okay, around 2 lakh eggs are hatched. Okay, it's laid by the female, and these eggs are removed from your body through fecal route through your feces. Okay, these eggs also go out of the body, but not all. Some stay. Okay, and some eggs which come out of the body can survive in the soil also for about 2 years. Okay, eggs can survive in the soil out of the human body. In your feces, it can survive outside for 2 years, and the larvae that hatch out of these eggs, if it's in the intestine, it can pass through the pulmonary phase, it can settle down in the intestine itself, and the life cycle continues. Okay. So it can cause cough, blood in vomit, eosinophilia, urticaria. Okay, these things can be caused because of the eggs that they are laying. In the intestine, it can cause pain. It can cause mass obstruction, not allowing the feces to move. Okay. It can cause pancreatic obstruction, biliary obstruction. It can go reach up to your mouth, and through the mouth, it can enter the nose and ear. It can perforate to your eardrum. Okay. So deworming it has to be done before you do any elective surgery. That is mandatory. Okay. Surgical treatment is required to remove these worms. Okay. So deworming is done. Antihelminthics like piperazine, pyrantel, pamot. We will see about this in detail in few slides. Once the worm is disappeared in mass after helminthic treatment, then you can go for surgery. Next is ancylostomatitis hookworm infestation. So they have this teeth-like structure that suck up at least 0.2 ml of blood per worm per day. One worm can suck up your blood. Okay, they suck into your veins, into your blood vessels. The eggs are also laid by the mature female, about 9,000 to 30,000 eggs per day. It can hatch out in the soil, and this eggs can reach through into your body through contaminated food, vegetables that come from contaminated soil. They can penetrate the skin of the feet, uh, uh, and they can pass through the pulmonary phase as well and settle down in the gut. So walking barefoot and all can cause an issue. Peptic ulcer can take place here. Albuminemia, hypoalbuminemia, too much less amount of protein in your blood because blood is being sucked out by these worms. They can survive up to a decade in your gut, and it can cause chronic ulcer type pain. Next is strongyloidiasis. So they also infect by penetrating through the skin in your feet, and they can pass through the pulmonary phase and finally settle in the gut. Okay, so walking barefoot can lead to this. Mature female worms can also pass eggs that immediately hatch out into larvae, and you can detect it in stool examination. And these eggs rarely hatch out of the intestine before passing out. Okay, so uh, it can infect the same individual over and over again. Dermatitis is seen at the area of penetration, the area through which this worm penetrated in the skin of the feet and all. That area will have itching, dermatitis. They will lose a lot of protein. There will be diarrhea, constipation, malabsorption, stomach pain, duodenitis. These are the clinical manifestation. Severe malnutrition will take place in this situation. Thiabenzadole Albendazole for 3 days is also effective. Taking albendazole, it's an anti-helminthic. Next is pinworm infection, enterobiasis. So, pinworm eggs are also ingested through food contamination, and it can hatch out in your stomach, in your gut, in your intestine. Okay, and usually at the cecum or at the appendix, this they inhabit it. And female worms can also go into the anal region. Okay, it can migrate towards your anal region, perianal region, especially at night to lay eggs. In the anal region, they usually lay eggs, and eggs remain viable for 20 days. It can cause intense itching and sleeplessness, vulvitis, that is, if in female children or females, it will cause itching in the vagina. Auto infection, by because when children, they keep on itching their butt. Okay, when they have this itching in the anal region, they will itch, and if without washing their hands, if they eat something, it will again, they are ingesting the egg over and over again. Okay, so again the larvae will go and hatch in the intestine. So female worms will go to the rectum, to the anal region. They will lay eggs there, and this will cause itching. And because of that itching, again, hands are contaminated. And if hands are not washed, they will eat the food contaminated with the eggs, and larvae will reach the intestine. They will develop there. Okay, young worms will develop in your small intestine. Okay, mature, reproduce. Again, the female will go to the rectum. It's like a complete cycle. This is how enterobiasis takes place. Mebendazole tablet can be given for a week, 12 doses. It is found as effective. Pyrantel, piperazine for 7 days. These medications are given. Next is trichuriasis infection, whipworm infection. So they also lay eggs that ingested when they are ingested through soiled food, contaminated food. Okay, they can also hatch out in your intestine. They can also inhabitate your intestine. They also suck blood. They depend on the blood. They suck blood up to 0.005 ml per worm per day. It can cause bloody diarrhea. Okay, blood in your feces, prolapsed rectum, anemia. Okay, colitis. Mebendazole and albendazole are effective in these two. These two medications are effective here. 2 tablets per day for three continuous day can also be effective. That is a deworming state. Then we have tissue nematodes. So they can hatch out in your intestine, but they can migrate to other organs away from your intestine. Okay, so that's what we call as tissue nematodes, because they are going into the visceral or the cutaneous, where you have subcutaneous tissue. Okay, organ tissue. Okay, they can find out those areas and they can go there. Okay, so cutaneous larva migrants are one form of it's due to animal hookworm larvae. Okay, it causes intense itching at the site of penetration, like feet, leg, hand, buttock, wherever. Okay, the intense itching will be there. Dermatitis will be there. They move at the rate of 1 to 2 centimeters per day. Local chloride spray can be used. Thiabendazole can be used. Albendazole can be used on areas where they have infested or they have got inside. Okay, if it is external, topical applications can also help. Visceral larvae, they go into the um, organs like liver, kidney, eye, brain, heart. They can cause lymphadenopathy, hepatosplenomegaly, enlarged liver, enlarged spleen. Okay, they are active up to 18 months, and with treatment, low dose of diethyl carbazamine, they can be treated for 3 weeks. Albendazole is also beneficial here in visceral larvae migrants. Then trichinosis. So it is caused by this Trichinella spiralis. Adults in small intestine, they lay the larvae in the tissues, mainly muscles. Okay. Undercooked meat and all, if you are not cooking your meat properly, non-vegetarians, you can get this infection. Striated muscles of heart, eye, brain, okay, they get encysted. And this infection, this larvae can live up to 5 to 10 years. Okay. You need aspirin, corticosteroids, albendazole, mebendazole, thiabendazole. These medications are required to treat it. Then filariasis, filial worms like Wucheria bronchofti, Brugia malai, okay, through mosquito bites, okay, mosquitoes are the vectors for this filariasis. It causes lymphangitis, lymphadenitis, elephantiasis, pulmonary eosinophilia. Then you have dog roundworm. They are ocular larva migrants. They can affect your eyes. Okay, they can invade the tissues of the eyes. Okay. Toxocara canis, dogworm. Okay, in your liver, brain, eyes. So these are the tissue nematodes. Then cestodes. Cestodes are a class of parasitic worms in flat worm phylum. They are not round worm. They are flat worms. Okay. Nematodes are roundworm. Cestodes are flatworm. They have ribbon-like worms. When the worms become adults, they have a ribbon-like structure, tape-like structure. So the first one is taniasis or tapeworm infection. Very common. Tapeworm infections are the most common type of infections. Okay. Adult worms can inhabit your gut. It can take up your nutrition. So it can lead to malnourishment. Beef tapeworm, pig tapeworm, fish tapeworm. There are different types of tapeworm from the different sources of uncooked flesh meat. Okay. And the larvae, they mature in the gut, and it can, the length can be up to 4 to 10 meters. They can live for many decades in your intestine. And they can cause abdominal pain, malnutrition, megaloblastic anemia, B12 deficiency. Okay, these things can happen because of tapeworm infection. Usually undercooked meat, if you're not cooking your meat properly, these infections can happen. They are very long in size, okay? 8 to 11 feet, or in meters, 10 to 4 to 10 meters in length. They can grow up to that. Then cysticercosis, again, the encystment of this larvae, that is when the larvae hatch, it hatches in your brain muscle, okay, muscle areas, striated muscles, due to the ingestion of eggs, from contaminated soil. And this larvae can live up to 5 years. It can cause lesions in your brain wherever it is occupied. Okay, it can cause lesions there, cyst there. And in the brain, when it makes cyst to occupy the space, it is called neurocysticercosis. Non-vegetarians who handle pigs, they can also get it. Okay, pig farming can also get this. Then you have echinococcosis. So humans are the accidental host here. It usually is transmitted between sheep, cattle, and dogs. Okay, humans are just the accidental host here, because in farmlands, if you have cattle as well as dogs, there are high chances the human will also get this. Okay, it's usually called as dog tapeworm. Eggs are passed out by dogs in their feces, and if the humans ingest this any dog feces infested food, okay, food contamination, it can go up to the humans as well, and it can hatch out in the human's larvae, lung, in the human's liver, lung, brain. It can also lead to hydatid list cyst. It can cause mass lesions wherever it is hatched. And if the cyst rupture, wherever the larvae cysts are present in humans, if that cyst ruptures, breaks off, it can cause anaphylaxis reaction, okay, hypersensitivity reaction. So albendazole, praziquantel, mebendazole, okay, these all are tried for several days. It can affect vegetarians as well, not just non-vegetarians. It can affect vegetarians as well if they are dealing with dogs. Okay. So diagnosis, how do you diagnose cystic disorders? First is stool examination. Mm, all the ovums, eggs of different worms can be understood. We can be diagnosed through stool examination. Then you can do duodenal aspiration through NG tube. Okay, you can aspirate the contents of the duodenum and uh, check the sample. Giardiasis and Stercoralis larvae can be understood through duodenal aspirate. Serology and skin test also can be done. ELISA test, heme agglutination test, hydatid test. These are the different tests that can be done. Blood test, skin test. Imaging, CT scan, X-ray, ultrasound can be done to find out space occupying lesions. Okay, you can't find out the larvae or worms here. but lesions that the larvae can cause in different muscles and different organs. Okay, those lesions can be found out. Then tissue biopsy can be done of your organ tissue to find out larvae migrants, trichinosis. Okay, biopsy can also help. So these are the different diagnoses that can help. Then anti-helminthics medicines. There is piperazine salt. Okay, it is available as 750 mg per 5 ml. They cause paralysis for the roundworms, and that's how they lead to expulsion of the roundworms. If the roundworms undergo paralysis, they can't move, they will be moved out of the body. But it is not safe for people who have central nervous system disorders. Then you have parental palmoate. It also causes spastic paralysis of the worms. It will paralyze the worm and lead to expulsion through your feces. If it is used against roundworm, hookworm, pinworm, 600 to 800 mg single dose can be given. Repeated for 3 days. It is not safe for people who have liver disorders. Then you have levamisole. It can cause muscle paralysis and expulsion of the worms. Okay. It is also used against roundworm, hookworm, eosinophilia, but it should not be given with milk. Then imidazoles like mebendazoles, albendazole, thiabendazole. It can kill the parasite. It is broad spectrum, effective against many types of parasitic infection. If one person has different types of parasite in their body, mebendazole can help. But it can lead to worm migration as well. So 21 days and all, you have to give 400 to 600 mg thrice a day for 21 days. Albendazole will block the glucose uptake of the parasite. It will kill the parasite. Thiabendazole, it's not easily available. Too much of albendazole can cause hepatitis as well. Niclosamide, it causes anaerobic phosphorylation, okay, and is effective in tapeworm. There are other medications like cysticide that will kill the cyst, diethyl carbazamine that will also kill the larvae, alcopar that will cause paralysis of the worms, mectizan that also causes paralysis of the worms. There are different forms of medications now. Most common ones are these. Practical guidelines and prevention. First is your anti-helminthic therapy. Albendazole is given a single dose only. Okay, there are limitations to bebendazole and multi-dosing. So albendazole is usually given a single dose and is available through all the primary healthcare centers. Free of cost distribution is also done. If there is a heavy roundworm load, two-step approach is taken. Initial, it is given through piperazine salt, pyrantel salts. Okay, then in second dose, it is treated with mebendazole. So depending on the parasite load, treatment will vary. Currently, biannual deworming is done with albendazole as a part of school health program. School children are given albendazole. Then we have targeted mass therapy as a part of child survival and safe motherhood programs. Okay, all the children under 5 and mothers are also educated regarding taking these medications. Even those who have pets at home, deworming of puppies, proper cooking of meat, uh, slaughterhouses where pigs are slaughtered for meat and all, slaughterhouses should be kept hygienic. Okay, these are the mass therapy, prevention and mass therapy. So that's about parasitic infections. If you have any queries, you can mention in the chat box.